Okay, let me simply introduce ICON. ICON is a BC emergency digital emergency program. Is conducted by Dr. Kendall Ho. It's been gone on for 17 years, and it will give to multicultural community patients and the family, giving everybody the chronic education, prevention, and self-management, and through the health webinar and also using online information, it can increase the patients knowing the management and also the lifestyle and also prevent and reduce the risk. And also at the same time, it would promote communication between community members and health professional, and also optimize the people's knowledge of digital information and improve their life quality. Okay, well, so today we have many speakers to talk on many topics. This is to strengthening health and wellness as we age, to understand frailty. This year, we only had one webinar just for one day. Today, we arranged for 3 hours to broadcast here. Our Q&A will be postponed to August 19. Please pay attention. But today, you still are able to pose your questions. Okay. Today, we are very fortunate to have many medical VIPs talking to us many aspects of frailty, to share resources, and also as we age, to strengthen our health. And we have Dr. Thomas Ho. He's a family doctor. Amy Yu, she's a registered dietitian. Wendy Lam, registered occupational therapist. Nicole Tai and Emily Peck, registered physiotherapist. Dr. Tigerson Young, clinical psychologist. Ken Lin, community pharmacist. Winnie Lau, registered psychiatric nurse. Thank you to all of you to take time from your busy schedule to take part in the webinar.
Okay, our next guest speaker, let's talk about depression in elderly. And we have our Dr. Tigerson Young, registered psychologist, to talk about depression in seniors. Hi, everybody, and thank you, ICON, giving me this opportunity to see everybody again and to share with you some ideas. And let me, we haven't met before, but some of you we have met before, some new faces there. So thank you, ICON, for holding this event. And today, let's talk about some frailty, and then let's, from this psychology perspective, to look at frailty from a psychologist point of view. So what's on the agenda? Let's talk about how to recognize signs of depression in seniors, and also especially depression, the effects, and how to identify activities to keep us connected and others, how to deal with depression in frailty. And let's begin with a question. So we are now in 2024, and what's the population? What's the world population in 2024? First of all, 8 million, and you have all the numbers there: 1, 2, 3, 4, 5. So which one is the correct one? So, what's your guess? Oh, wow. And now we have 8,000 million people in January 2024, lost people in India and China. And India will reach 1.6 and China will reach 1.4 billion people. And what about 65 people who are 65 years or older? So you look at the percentage, so it's 10% and all the way to 16% in 2050. So that's equivalent to, it's like, yeah, so we have senior people and young people, and then they are more or less sharing the same percentage. So 65 plus ages, where are they from? The sources of people. So in the 1980s, mostly from the Western countries, like countries in Europe and American, and now it's more the Asian countries, like 65 older people. They are mostly from Hong Kong, and then Korea, Japan, Taiwan, and Singapore. So mostly from Asian countries. And if we look at people who are 80 years old or older, and growing fastest is from 2021 to 2050. You can see the number 1.6 billion in 2050, and we are still quite young if compared with that. And life expectancy, this is the world trends in 200 years ago, in the 70s and 200 years ago, and the life expectancy is just 30, 40 years old. And now, in the 21st century, our life expectancy is almost like 80 years old. So it doubled the age 200 years ago. And if we look at Canada, our average life expectancy is 81 years old in 2022.
We know men shorter a little bit than women. In the last few years, we have shrunk a little bit from 2021 at 83 to 81.3. So it's a little bit less, not too much. Maybe it's got to do with COVID. Perhaps it's more or less to do with COVID, with aging. Some physical disease corresponding to age also increased, like in 2021. In U.S., they selected 10 major diseases: high blood pressure, high cholesterol, diabetes, and arthritis. We're well aware of that. We have heard a lot, but one of which has got to do with psychology. What is it? It's depression. Okay. It's 10 major diseases. Is one of them. Okay, really speaking, we all have up and down moods, right? Actually, what is depression? And depression is slightly different from our high and low mood. Say where there's a natural disaster, we might have depression is very normal, right? So clinically, the depression we see is slightly different. And today we've learned a lot information about frailty. We also understand actually frailty itself is not a disease, is not heart disease or arthritis, it's a condition. And this biological condition is got to do with our mental state. So one of that can make that change is our mood health. Is what we call depression. Of course, like we said earlier, everybody has got up and low mood, and also depressed times. Sometimes maybe it's got to do with the outside environment, natural disasters. So this kind of condition with this kind of change in mood actually is a very normal reaction. Actually, nobody told me. Say for instance, after my car accident, I am very happy. I'm very elated after I got collided into. Nobody is like that, right? So clinically, this depression, you can say that is slightly different with the normal reaction. Clinical depression is when your mood change is more than the ordinary person's reaction, and also in terms of timing is maintained a certain period of time, unable to be adjusted to swing back. So it's more than the natural reaction. It's no longer just a natural reaction. In terms of depression, actually it's quite common. Clinically, patients about 25 to 50 clinical patient, they have that depression. So between 2 to 4, amongst 2 to 4, there's one females have double that amount. So are you saying more female depressed? No, may not be so. Maybe the male people, in terms of their presentation, is slightly different. You see, we male, we don't hardly talk to people about our moods and go see a doctor. Maybe it's because of that. We won't know whether the male people have less episode of depression, right? And also, actually started from teenager to in 20s is a peak. Depression can be. You can look at it as a chronic angle. Chronic means that the condition has been around for a certain period of time, at least 6 months or more, and is not improved. Then we call it a chronic condition. And later on, we will look at it in more details. Okay, in 2021, depression newsletter, there's research issues in the country. About 20% have got this problem. That means in domestically, in terms of senior people, actually, it's got to do similar to the Western world. 1 in every 4 to 5. What are the causes of depression? You ask. Actually, there are 2 origin. One is nature. One is nurture. Maybe nature has got to do with some chemical in our brain. In our brain, there's some delivery substance. When it's imbalanced, then the theory is because it's imbalanced, so it causes our mood to change. In our brain structure, it may be the cause for us to have depression. For instance, say the cortical thickness, actually the thickness when it's different, our mood, the reaction perhaps is different. We realize if the thickness is more, the episode seriousness may be less. So it's inverse corresponding. So it may cause us to have some mood change. And genetic is maybe another factor. Some research found out that if the parents have depression, then the children may also have depression. The risk may be higher by 3 to 5 times. And the episode may start earlier, and the seriousness may be more, and also the reaction to treatment may not be so good. And nurture, in terms of nurture, what factors are there? we've heard that icon, people who have heard icon, they heard about stress factor. We know that stress is very closely related to our mood. When we are under stress, our body will be naturally have some reaction. One of that is for your body to release to cortisol, and that would help us, our cortex. It would give us more energy to deal with the outside stress. Clinically, actually, we realize when we have long-term stress, perhaps it may have serious impact on us physically if we are affected by cortex long-term. We realize in some animal, the brain, what will happen, they will shrink. The cells might shrink also. You may say those are little lab mouses. Mice, are they comparable to people? We don't know, so we can't just give long-term stress to people. We can see from the rat mice model, we can see that actually we can see clinically there's some serious depression. We can't go through them all. Actually, we will talk about the more common one is major depression. In other words, is means that is not general, is not common, caused by the outer factors, because that's a very normal reaction. When something happened, after something happened, our symptom may get more than some other people, and it lasts longer than other people. Actually, depressive symptoms have different. If you have in 2 weeks 5 major symptoms, you can call it an urgent depression. What are the symptoms? There are different types. For instance, loss of appetite, sleep disturbance, loss of concentration, agitation, low mood, or even you think about harming yourself. As long as you have 5 or more of that symptoms, or at least, and they around for 2 weeks or more, you can bounce back. That will be symptoms of depression. If you ask, then what can I do? If I can only do one thing, what should I do? Then my suggestion is you must adjust your sleep. When your sleep is your lack of sleep, or the quality is not good, your body cannot recover the normal range. So one of them that you can change the frailty state is when you to look for a way to change the quality and duration of sleep. You have to learn. If the bed is only for bed, don't watch movies or think of things or eat on your bed or worry on your bed. So your bed will become for more than one purpose. So you have to learn that the bed in the bedroom is only used for sleep. Okay, see whether it's possible, see whether by doing that you can change the time and quality of your sleep. Actually, there's a lot of resources online. This is the Hong Kong Association website in Taiwan, and other countries have this medical website. You can go look and see whether you can improve your sleep from those websites. If I have more time, more resources to do other things, what can I do? And the second thing is try. Keep learning, because when you are learning, actually, it will help your cortex. When the cortex is healthy, more healthy, perhaps your mental state, your frail state may improve. Good news, there's a research when you are learning. You don't have to learn too much. Every week, get some old friends. 3 times a week, each time about 2 hours, you can learn very, very simple, fun things like language, music, painting. photography, for instance. You don't have to learn very difficult stuff. What we've realized after these few weeks of learning, the cortex function is much better than before, and you know how effective that is. It may last for over a year. See, think about it, how important it is. In BC, we are lucky. We have different resources like UBC for 60 people 65 and over. You don't have to pay a fee. You can go take some courses and other places to save. This is in Toronto. In the university, they have courses for us to look at. What you say, my English is not so good, what should I do? Never mind, you can look at overseas, like Hong Kong University. They have similar courses. Some of them, a lot of them are free. You can try to keep learning, maintain your physical, mental health. If you have more time, other resources that can be do. What can I do? Try exercising, right? You can feel a lot of exercise standards. You at least maybe 3 times a week. I have 10-20 minutes each time. Maybe that's a good start. It can help you improve your mental state, help you improve your frailty. Maybe there's some improvement. Very simple. Just simply, you can't do much. What about walking? Just walking, right? You can try that. And next one, what can you do if you have more time? Learn new strategies. Sometimes you have to solve the problem. You solve your mental state, your condition. Perhaps what you have to use is use a different angle. I have an IQ question for somebody. A big size guy went to open the door, can't open the door. There's old lady waiting. I say, use more force, use more force. But this is a big size guy, but he couldn't open the door. The old lady said, oh, I'm agitated. Okay, go away, let me. The old lady could open it easily. Why? You know why? Oh, actually, the door is not for pulling, it's for pushing. The big size guy used all his strength to pull the door. No use. Of course, he couldn't open. He just push it. So it's just the way of looking at stuff. Perhaps that it would be helpful. Although a lot of the people told us you can learn different strategies, use different method to look. It's may be good, may change our mental state or condition. Another thing, use pets if you have more time. Some people tell us actually pets are useful. What can pets give us? Give us structure and also give us direction. I have to take care of the pet. It gives us a direction, sense of direction. It may not be a dog or a cat. A patient likes a chicken. Looking at the chicken running all around, the patient is happy. So you see that many ways. In BC, we are lucky. We have different community resources, like ICON is a community resource, and different information we can try to learn. See whether it can bring us new knowledge.
So BC government also has lots of different services and for seniors. So yeah, take advantage of those sources in our educational institutions. For example, here you have this self-management BC, and then so we can learn different skills. So today I'd like to give you some information from the psychologist perspective. How can we improve our emotions and make sure we have we can better deal with this issue of frailty? Thank you, Dr. Yang, for your detailed information and how to deal with depression, and also lots of tips for us to we can try.
There's some upcoming events. We are busy in July, August, September. In July, we have 2 dates that's been scheduled. One is July 12th, one is July 22nd. both in the morning, 2 different webinars, is to do with the summer extreme weather series. One is managing chronic kidney disease during extreme summer weather. The second one is chronic disease management during extreme environmental conditions and wildfires. And also in terms of respiratory system, we have 2 speakers to talk to us. And that's in July. In August, Tuesday, August 13, using apps to support your health. We also have Wendy, who talked to us today about fall prevention. She'll talk about that topic. And on August 19, we go back to today's Q&A session. If you have any questions, you can write them and send them to us. We will arrange for speakers to answer all the questions raised. And in September, that's our annual the Success Health Fair. That's on September 15 on a Sunday. It's an all-day activity. ICON arranged for 2 speakers. One is specialist doctor to talk about chronic pain management, and the other speaker is family doctor to talk about using apps to support your health. I hope you all will pay attention. And your way of contacting us, there are many ways. You can see those on the screen. Keep in touch with us if you are subscribing to our the newsletters. You can join in this email correspondence. There will be, when there's a webinar or other activity, you'll be informed directly. ICON, thank you very much to the Patient as Partners Initiative support, and also we are thankful to our community partners. Thank you to our media partners. Thank you to all the viewing hubs community partners. Lastly, we are also very grateful. Thank you to our speakers today, including Dr. Ho, Amy Yu, etc. Lastly, we have to thank all our several interpreters behind the screen doing the interpretation for us, Shiny, Susan, Linda, Adam, and also thank you, MB Interpretation Services. And hopefully next time when we have the webinar, we'll meet with you again.